Hi, my name is Carly Hardy. Some of the field work that I've had was working in a school as well as working in the hospital setting. Last year, my field placement was at Main Street Elementary School, where I worked with students in the elementary grades. And some of the students that I worked with had intellectual disabilities. This year, my field placement is at Crozier Inpatient Psychiatric Unit, and a lot of the patients that I'm working with there have different types of mental health conditions that are going on, and there are a lot of different types of cases that we see. All of the patients within our unit are either 302, which means they're involuntarily committed into the unit due to possible self-harm or endangerment, as well as endangerment to others, are some of the biggest ones. And the other way that someone would get into our unit is by a 201, which is voluntary commitment, and they sign themselves in. So a lot of individuals who have suicidal thoughts or have harmful thoughts to others, they would sign themselves into the unit because they know that they want to be put into a safe place. So my main role in the unit is that I work alongside the practitioner. I work with the psychiatrist, and we meet with the patients every single day. We go through every patient. The unit, there are 34 patients in the entire unit, but there's 2 different doctors. So we separate them. They're usually about half and half, but it kind of just varies. So we see every patient in our group every single day individually, and we go through. First, we'll start with the new patients of the day, and we'll do our initial assessments of them, and then we'll go through and meet with the patients who have been in the unit for a few days and just check in and see how medicine's working and how they're feeling, and try to get a better idea of what their stay is like. The unit that I work in is a short-term stay, so it's about 3 to 7 days on average, but some are shorter and some are longer, just depending on the cases and what the patients need. The next question would be, treatment team. Yes, so I work with treatment team on Tuesdays. We have treatment team every week, so that's when the doctor, social work, psychologist, and the nurses all meet together, and we meet with every patient, and we kind of just go through and make sure that everyone is on the same page with everything, as well as the patients, if they have any questions for anyone, that they can ask it when everyone's in the room rather than having to ask everyone individually. So I have experienced a lot of working with the doctors this year and the patients, and that side of the social work aspect with individuals with mental health conditions at my internship at the inpatient psychiatric unit. I look forward to the class and getting to know everyone.